Pandemics throughout history. How the lessons of the past were ignored in modern times. Pandemics have had a lasting impact on humans throughout history, profoundly changing economies, governments, and social structures. The world has changed dramatically as a result of these crises, which range from the horrific Black Death of the 14th century to the worldwide catastrophe of the 1918 influenza pandemic. Additionally, every one of these historical outbreaks taught us important lessons about public health, readiness, and the value of quick, coordinated action. However, as the globe dealt with the extraordinary difficulties posed by COVID-19, it became evident that many of these lessons have been overlooked or forgotten. Even with millennia of experience, COVID-19 caught modern governments and health systems off guard. Medical supplies were in short supply, hospitals were overburdened, and public health measures including mask wear, social distance, and quarantine were either applied too slowly or inconsistently. Political authorities delayed putting short-term economic worries ahead of long-term health effects despite the fact that pandemic response delays result in fatalities. Moreover, nations withdrew inward, fighting for resources and presenting divergent policies in place of a unified global front. It's important to recognize how many of the errors made during the COVID-19 pandemic were not novel as we consider the outbreak. By looking at the pandemics of the past, we can find the important lessons that were overlooked in the present and comprehend how these mistakes made the situation worse. 1. Inability to ready for the certain. Large-scale outbreaks are not only feasible but also unavoidable, which is one of the most important lessons to be learned from previous pandemics. Governments and international health organizations, however, have frequently been caught off guard when the next pandemic strikes. The 14th century Black Death, which claimed the lives of 75 to 200 million people, served as a precursor to the fast population decline caused by infectious diseases. Following the destruction, a number of nations, particularly Italy, imposed quarantine laws to stop new epidemics. These laws eventually proved to be crucial for controlling pandemics in the future. Let's go back to 1918 and the influenza epidemic that killed an estimated 50 million people and infected around a third of the world's population. Many of the tactics used back then, like mask use, social distance, and quarantine, are also the ones that have been suggested for COVID-19. However, COVID-19 caught modern countries off guard, highlighting a lack of readiness for another pandemic despite repeated warnings from health specialists over the last 20 years. There was a dearth of adequate public health infrastructure, personal protective equipment (PPE) stockpiles, and thorough pandemic response strategies in many nations. 2. Public health response delays. The necessity of quick action is another thing we can learn from previous pandemics. Places like St. Louis that moved swiftly to implement social separation measures during the 1918 flu pandemic saw fewer fatalities than places like Philadelphia that took longer. Many countries took too long to respond to COVID-19, delaying the implementation of lockdowns, travel restrictions, and public health guidelines despite the obvious historical precedents. Healthcare systems were overloaded with cases as a result of the delayed response. Hospitals were overburdened in nations like Spain, Italy, and the United States, and the death toll increased due to a shortage of beds and supplies. Governments have frequently refrained from taking immediate action due to political or economic concerns, despite the abundant historical evidence that prompt intervention saves lives. 3. Undervaluing the importance of clear communication. During pandemics, efficient communication is crucial for controlling public sentiment, averting panic, and guaranteeing adherence to health precautions. Confusion regarding the disease's origin during the Black Plague caused widespread fear and false information, which accelerated the disease's spread. Similar to this, during the 1918 flu, a dearth of consistent message from public authorities caused many people to be unprepared by spreading false information about the virus's severity. This lesson was also grossly disregarded in the modern period. Political figures and public health experts miscommunicated during the COVID-19 epidemic, raising questions about the virus's seriousness, masks' efficacy, and the value of vaccinations. On social media, false information circulated quickly, which made people distrustful of and resistant to health recommendations. Governments were unable to bring the world together in a coordinated approach, which led to conflicting advice on how to contain the virus. 4. Inadequate infrastructure investment in public health. Pandemics have shown the flaws in the public health system throughout history, but contemporary civilizations have frequently underinvested in their healthcare systems, making them susceptible to pandemics. Significant holes in the global healthcare infrastructure were found by COVID-19. Hospital capacity was rapidly exceeded, and in many nations, there was a shortage of ventilators, testing equipment, and intensive care unit space. Although previous pandemics should have highlighted the value of funding public health, many nations were unprepared, which compelled governments to enact emergency measures to support faltering healthcare systems. 5. Ignoring international cooperation's role. Pandemics are international problems by definition. The global transmission of the 1918 flu and the Black Death's cross-continental spread, enabled by trade routes, and brought attention to the necessity of international collaboration in the control of disease epidemics. Globalization and worldwide travel have increased the likelihood and difficulty of pandemics in the modern era, necessitating coordinated action to contain them. In spite of this background, the global response to COVID-19 was not cohesive. Countries follow their own policies, frequently without consulting one another or international bodies, such as the World Health Organization (WHO). Worldwide responses to COVID-19 were characterized by nationalism and rivalry, hampering efforts to contain the virus on a worldwide scale. However, lessons from previous pandemics demonstrate the importance of international cooperation. 6. Ignoring pandemics' economic repercussions. Although pandemics have historically had a significant negative economic impact, contemporary governments frequently prioritize short-term solutions over long-term financial effects. Massive economic disruption brought about by the Black Death resulted in inflation, a labor shortage, and a change in the economic landscape of Europe. Despite these lessons, many countries' first response to COVID-19 was mostly focused on controlling the health crisis with little thought given to the financial consequences. Widespread employment losses, broken global supply lines, and worsened already existing economic disparities were all caused by the pandemic. Past pandemics could have taught governments that long-term planning and investment in reviving impacted industries and providing assistance for workers are necessary for economic recovery. 7. Ignoring the pandemic's social effects. Pandemics have always had a major societal impact in addition to health and financial ones. Social systems change as a result of the Black Death, with a decrease in feudalism and an increase in social mobility. Social behaviors were changed by the 1918 flu, which increased awareness of the value of public health measures and hygiene. But contemporary governments have frequently ignored the societal ramifications of pandemics in favor of managing crises as they arise. Although the past demonstrates that pandemics frequently alter social structures and behaviors, not much has been done to address these fundamental problems. Many countries neglected to enact policies that could have lessened the crisis' long-term societal effects instead of seizing the chance to create more just societies. As with other pandemics, the social effects of COVID-19 are expected to last for years, ranging from the mental health toll to gaps in education. Final thoughts: pandemics are not a recent occurrence, and past experiences have taught us important lessons about how to efficiently handle these emergencies. Past pandemics, such as the Black Death and the 1918 flu, have taught us the value of foresight, quick thinking, effective communication, a robust public health infrastructure, international collaboration, economic foresight, and consideration of societal repercussions. However, many of these lessons were disregarded when COVID-19 first appeared, which resulted in extensive suffering and drawn-out rehabilitation efforts. It is essential that we keep in mind the lessons learned from the past in order to better equip ourselves for pandemics in the future. Let us know in the comments what you think about the pandemics throughout history, how the lessons of the past were ignored in modern times, and don't forget to like, subscribe, and stay tuned for more captivating content on our YouTube channel.